Hi everybody, it's Ajanette and I'm here to cover your Chapter 9 lecture on conception, pregnancy, and childbirth. So many people explain pregnancy as a beautiful, miraculous thing, and as a woman who's birthed 4 children, I can say that pregnancy can be miraculous, but not everyone chooses to have a baby, and that's okay too. So pregnancy and childbirth in and of itself does not make us a woman. Our womanhood is not defined by our status of motherhood. And so I just want to put that out there as we go through this chapter. We shame women sometimes who choose not to have children. We are sometimes insensitive to women who want children but cannot have children for a variety of reasons. And we also don't always pay respect to women who individuals who identify as a woman but may not have the means to have children. And that doesn't make them any less of a woman. So I want to be really, really clear on that as we move into this chapter, while still celebrating the beauty of creating life that many women experience. So not all women, but many women. So let's talk about conception. That's the process of actually fertilizing a gamete. When we talk about a gamete, we're talking about the sperm or the ova. They have 23 chromosomes respectively, and when they come together and unite, that's called a zygote. So a fertilized ova is called a zygote. Ovum is called a zygote, and that now has 46 chromosomes to create an individually a human. A cell that can grow into a human being. Many of them don't, but conception is that union that creates the zygote. It happens quite often in the fallopian tubes. Typically, women release 1 ovum per ovulation, which is, per month. So about 1 egg a month has the opportunity to be fertilized. Just for that 1 egg, about 200 to 400 million sperm are ejaculated. So 1 ejaculation produces 200 to 400 sperm. And it takes all of them to find the ovum. Only 1 fertilizes. They actually release a hormone that helps to break down the zona of the egg, which is like the outside shell of the egg, and that this right here, the enzyme breaks it down, and that thins out the zona so the sperm can penetrate and fertilize the egg. Only about 1 in 1,000 sperm actually find the egg. That's despite the fact that the egg is like releasing this GPS signal to let it know it's there. And it's like a race. They have 48 to 72 hours to fertilize the egg. When the egg is released, it has enough supportive structures to keep it alive through fertilization and then its journey to the uterus, because remember, fertilization usually happens in the fallopian tube. So it's quite the process. And the odds are not great, right? But it happens naturally throughout the existence of mankind, and so we are able to carry on this species. When you're talking about trying to improve, I do want to go back. Often, many women will experience spontaneous abortion without even knowing it. And that is when you have a sudden and unexpected, involuntary expulsion of a fertilized egg or a zygote from the uterus. Usually it happens within the first month, but it can happen anytime throughout the pregnancy. We also call this a miscarriage. And some individuals, just so you know, the vagina is very hostile. It actually creates chemicals to protect it from sperm, right? The uterus is very hostile. And so these sperm are fighting to find the egg, fertilize the egg, and then the egg, fertilized, the zygote, is now fighting for implantation and survival too. So it's not uncommon that the body expels it. And many individuals struggle with infertility, which we'll talk about in a little bit. You want to try to increase your opportunity to get pregnant. Then you can actually try to make sure you're having sex within a few hours of ovulation. And you can actually monitor your ovulation through doing a basal body chart and keeping track of your temperature and tracking that and logging that. You can actually try to increase the frequency of sex, but when you increase the frequency of sex, those 200 to 400 million sperm are released in the first ejaculation. And if you haven't ovulated, then there's no egg to fertilize. So you're reducing your sperm count because it takes the body time. The male body is like a manufacturing plant. So it needs time to reproduce, to produce those sperm to replenish. So there's also urine and saliva tests that you can check for luteinizing hormone, which lets you know that's released just before ovulation. You can track your vaginal mucus. Our mucus actually can become really slippery and clear and thin before ovulation, and then it becomes opaque the day after. And you can have sex in the traditional male superior position, and then women can tilt their uterus and lift their legs up to increase opportunity for conception. Many of us actually are trying to reduce chances or risks of conception, but there are reliable techniques that you can use to try to increase your opportunity. Just an example of a basal body temperature chart. Sadly, there are different cultural views on the sex of a child. All ova are X chromosomes. So all of the eggs within a woman's body are set up to have an X. Now, as you know, an X is necessary. Men are XY, women are XX, or I should say females are XX, and males are XY, because we're talking about sex, not gender, right? So all ova have the X chromosome. It's the sperm that can be X or Y. So it's the sperm that determines whether or not the child's going to be a male or a female. Interestingly enough, historically across cultures, we've often shamed and blamed women for not producing a male child or a male heir. And in reality, it's the sperm that determines the sex of the child. Interestingly enough, if you look at Y chromosomes don't have as much genetic material. The X chromosome has more genetic material. So consequently, the Y sperm actually swim faster. This actually increases the chance that you're going to conceive a male baby. So 20 to 50% more male babies are conceived, yet only 5% more male babies are born. So male babies are actually more likely to die off in the uterus or to experience spontaneous abortion than our female zygotes. Interestingly enough, that's the case throughout life, where men die at higher rates than females at every stage of life, and that's kind of universal. Boys often also have a higher infant mortality rate. So interestingly enough, we end up with 50-50, but in reality, we know that more male babies are conceived. There are cultures where sex is prized, and so individuals might want to select the sex of their child. Sometimes people want to do it just because of a personal preference, or they've had 5 boys and they want a girl to offset or something like that. Or sometimes there might be sex-linked diseases that are associated with their family health history, and so they want to reduce the risk of passing it on, and so they will determine what sex of the child they want to have. Now, there are all kinds of folklore and myths that suggest, different ways that you can increase your chance of having a boy or girl. But from a probability standpoint, given that the Y chromosome's been swim faster, it's not exactly a 50-50 chance. If we're looking at pure outcomes, we'd have to know what percentage are Y and what percentage of those sperm are X chromosomes. But sadly, in some cultures, because you might have a limit on how many children you can have, and certain cultures prize males over females, infanticide is common, where I don't want to say common, occurs, where they actually murder infants who are under 12 months of age. And historically, females have been the ones who have been most likely to be victimized by infanticide. There is a pre-implantation genetic diagnosis you can do that actually allows you to see the zygote and determine what the sex of that zygote is chromosomally. And then you will choose which embryos you're going to implant, and you choose the sex of the embryos that you're going to implant. Infertility is when individuals cannot conceive after actively trying for 12 months. And it's more common with older women. So if you want to have a baby later in life, it's really important to work closely with your doctor. We do know that about 15% of couples struggle with infertility. Most of those, I don't want to say most, half of those go on to have children. And you can actually get treatment. However, it's expensive. So there's some equity issues here in that, only wealthier individuals have options, have access to all the options available. So male infertility often results from low sperm count. That is the most common problem contributing to infertility overall. So remember, we said that about 200 to 400 million sperm are released with an ejaculation, right? Well, a low sperm count is considered anything below 20 million sperm in an ejaculation, which is about 10% of what is normally required to actually produce a zygote. So now that could be because the testes aren't descended or they're not low enough. So the body temperature, actually when your testes need to descend lower than the body because the body temperature kills off the sperm. So they need to be maintained at a lower temperature. Also, if you're, engaging in too much sex or masturbation, you're reducing your sperm count again because your body needs that time to replenish the sperm. And so often if you are struggling with fertility issues and you're trying to conceive, they will discourage you from masturbation during that time so that you can be preserving your sperm for conception. Sometimes our sperm are just shaped wrong. They have motility issues and they can't swim. We call that self-propulsion. They might have two tails or a deformed tail. Sometimes if the man has chronic diseases like diabetes or any kind of STD, that can affect a sperm count. If there's been any kind of trauma or injury to the testes, that can be problematic. If there's any kind of like cancer or autoimmune disease that is causing the antibodies to kind of kill off the sperm. And then sometimes the pituitary gland or the thyroid gland isn't producing the proper hormones, and so that affects sperm production as well. And that can be due to a number of things, whether it's genetics. Older men actually have we often describe men as being able to have kids into their 80s until the day they die. Maybe, but they also are more likely to have children that have schizophrenia, autism, and so bipolar disorder, other psychological disorders. So it's really important to know that we need to be looking at the men's biological clock too. We typically focus on the female's biological clock, and historically women have been blamed for challenges, but we do have an increasing number of research studies that are showing there are detrimental effects of men being older and conceiving children as well. And just some other, just general stress levels can impact, and sadly, dealing with infertility issues increases stress levels. So you have to be really intentional and conscious about reducing and managing stress during this time. Some of the things that they do to actually address challenges with infertility as it relates to the man is they will actually reduce the temperature in the testes, whether that's wearing different undergarments, cooling undergarments, avoiding any kind of hot tubs, wearing boxers instead of briefs or nothing at all. You can do a microsurgery that goes in, and if there's any kind of blockages, they can open up those blockages. You can also do artificial insemination, where you actually inject sperm into the reproductive tract, not during sexual intercourse. So, it's intercourse would be a natural insemination, but artificial is using outside tools and resources. Sometimes you might need to use a donor sperm if there isn't sufficient sperm with the male. It's not uncommon that, we'll get into that. Anyway, female infertility. Often this is problems with ovulation. So about 10 to 15% of cases of infertility are because women just are not ovulating. That could be due to hormones. They might actually intervene with hormone treatments. It could be malnutrition. Our body actually can't support ovulation if we don't maintain the proper fat levels. Definitely genetics can play a role, and again, our pituitary gland, which produces our follicles or activates our follicle stimulating hormone and our luteinizing hormone, so that our eggs will mature and release. And it could be you've had just a shit ton of babies and your body's like, no more. There can be obstructions, malfunctions. So if there's structural issues with the fallopian tubes or the uterus or the ovaries, if you have pelvic inflammatory disease, sometimes gonorrhea, chlamydia can actually cause challenges with infertility, both of which are bacterial and can be treated with antibiotics. So that's important to know. Endometriosis, you have endometrial tissue and cells, and those cells can break off and actually start to grow in other areas of the body. They often are, they grow in other areas of the reproductive tract, but sometimes they can actually grow on other organs in the abdominal cavity, and it can be very painful and debilitating. Interestingly enough, one of the things to treat endometriosis is getting pregnant. It actually reduces the negative effects or symptoms of endometriosis, but it's hard to get pregnant when you have endometriosis. So they can do a laparoscopic exam and actually put a camera in to inspect your organs and see if you have endometriosis. They can do biopsies as well, but those aren't, they're not always guaranteed to find things. And then hormone levels can also contribute to infertility challenges. So what they often do to treat it is they might include, hormone regulation, like put you on a birth control type thing to regulate your hormones. But many couples will actually utilize in vitro fertilization. Again, expensive, so not available to everybody. People who have wealth have access, but the mother will take hormones that will actually cause her her eggs to mature and ovulate. Then they go in and they retrieve those eggs, and they will they'll get sperm from either the father or a donor sperm, and they will actually fertilize the egg in a petri dish, right? And then they will now take those fertilized eggs or those zygotes, and they will inject them back into the mother's uterus, and then they will see if the zygote actually implants. So you can have, here's some different types. You can have a gamete intrafallopian transfer, or a gift. Gamete, again, is referring to the egg or the sperm. So they're inserted together into the fallopian tubes and hope that they kind of find each other, meet up, and fertilize. The zygote intrafallopian transfer is a more complicated process. This is where they actually do the fertilization first, and then they will inject the fertilized egg or the zygote into the fallopian tube. You can do that with a donor in vitro fertilization, where another female, her egg is fertilized, often with the desired father's sperm, and implanted into the mother. So the mother might have a functional uterus, but for whatever reason she's not producing eggs, so she uses a donor egg. And then you can do an embryonic transfer, where a woman volunteers to be artificially inseminated, and then 5 days later the embryo is removed from the volunteer and inserted into the mother. So you're not necessarily fertilizing in the laboratory. You're fertilizing through the use of another woman's body, right? So you also have intracytoplasmic sperm injection. So if a man has too little sperm and can't produce enough sperm for the in vitro, then sperm cells can be injected directly into the egg, the ovum itself. So that's why it's called intra within cyto, the cell plasma. And so unfortunately, though, we have research to suggest that it might have a higher risk of birth defects, heart, stomach, kidney, or bladder problems, cleft palate. So there's some structural deformities that are a risk. You can have a surrogate mother, where a mother can either be artificially inseminated, or she can actually use her egg and carry the baby to term. So there is a host mother, and then of course there's adoption, and all of which we should never judge. You can still love your child regardless of how that child came into existence. So a child is a child is a child. In terms of pregnancy, your body produces human chorionic gonadotropin, or HCG as we call it, and that's what the pregnancy test is testing for. Typically in a blood test you can see that HCG rise within 8 days, but home pregnancy tests can detect it in your urine. Typically it takes about 1 day into pregnancy, and so although you can start to produce HCG after fertilization, the baby's fertilized quite often in the fallopian tube, most commonly, as we talked. Needs time to travel to the uterus. It's not actually implanted in the uterus. That's about a 2-week process. And so, you figure your pregnancy test is going to be most accurate after that time. Most of the time we don't know until we've missed a period, and that can be like up to 4 weeks after we've had, we've conceived, and it could be longer because we don't notice we miss the period right at 28 days quite often. So it's really important to recognize during that time you can cause birth defects to your baby. So I always say, people say don't drink while you're pregnant. I say don't get pregnant while you're drinking. So if you're actively in a partying stage, take precautions, whether it's condoms or whether you're actively on birth control, a reliable birth control. But most definitely try to make sure you're not getting pregnant, because most of the time we don't know we're doing damage because we don't know we're pregnant. Early symptoms are breast tenderness. You get tired. Some women have morning sickness. I never did. It's funny, it's called morning sickness because most of the women that I know, you're not just sick or nauseous in the morning. You can be sick throughout the day or at random times during the day. If you have twins, it increases your risk. Interestingly enough, there's lower rates of miscarriages and stillbirths with women who have morning sickness, which is interesting. If you look at it from an evolutionary standpoint, it could be that this was a natural way of developing food aversions for women because we didn't want to ingest poisonous things or things that could be harmful to the baby. So eating crackers, juice, if it's too severe, you might have to be hospitalized and they offer treatment. So miscarriages or spontaneous abortions can be due to chromosomal defects. So the body kind of knows that something's wrong. Additionally, if you're an older woman, your risk is higher. And it usually happens within that first 16 weeks, about 75% of the time. But most often it occurs within the first couple of months. Most women don't even know that they were pregnant when this happens, and they might just have a little bit heavy period, a little bit more cramping. But when you do know you're pregnant and then miscarry after, it can be traumatizing. So it's really important to be sensitive to individuals. Some people don't want to share that they're pregnant until they're past 12 weeks when your risk of miscarriage declines significantly. Many women will miscarry and go on to have a perfectly normal pregnancy, so don't be scared or discouraged. If you have a history of miscarriages, that's when you want to talk to your doctor. It is okay to have sex during pregnancy. It's not going to hurt. It's really important to recognize the different names, but at fertilization, it's called a zygote. Then as it's traveling to the uterus, it's called a blastocyst. Then it becomes implanted, and now it's an embryo, and we move into the embryonic period. And then as it grows past those 6 weeks, it becomes what we call a fetus, and then we reference it as a fetus from that 8 weeks forward. And so that being said, sex during pregnancy doesn't usually hurt the zygote, blastocyst, embryo, or fetus. And, if you have a history of miscarriages, they may actually want you to not have sex just in case that is a factor. Sometimes your interest in sex declines during that first trimester. The second trimester is usually the best time for sex. Can get uncomfortable in that third trimester. But manual and oral sex are still very much options because it might be uncomfortable. Sometimes people just get stressed or nervous, but know that you do change psychologically. Some women are happy and ecstatic during pregnancy. Others aren't, especially if it was an unwanted pregnancy or an unplanned pregnancy. I say they're not mistakes, they're surprises, right? But, that doesn't mean that we all decide to carry them to term. There is, a number of reasons why people may not want to continue the pregnancy, and they're perfectly within their rights not to do so. But recognize that you want to make sure you're looking at your long-term psychological health and well-being, and in that first trimester, it might be harder when you're ambivalent about the pregnancy, right? So just pay attention, especially like if you have a history of depression, pay attention for postpartum depression. Pay attention to make sure you're getting the support that you need through pregnancy. Again, that second trimester is a little easier. The third trimester can be really stressful. You start to lose sleep. There's a lot of pain and discomfort. You're not as ambulatory. So it can be a problem. So due dates are interesting. Our due date is when the baby's estimated to be born. Recognize that we count the due date as based on your last menstrual cycle, and you may or may not have become obviously pregnant at your last menstrual cycle. So they have like a 4-week kind of wiggle room in there, right? So that's why if you look at 280 days, that's about 10 months. We talk about a 9-month pregnancy. but they actually calculate your due date on a 10-month basis. So that's really interesting. We usually deliver the baby within about 10 days of our due date. So anywhere, your 40 weeks is pregnant, is a normal pregnancy period. Again, counted from your last period, not your date of conception, because they just don't know that. But give or take 2 weeks, right? So different methods for determining your due dates. Once you are pregnant, there's 3 different stages of what we call prenatal development. So as soon as that zygote, that fertilized egg, is produced, it's in the fallopian tube most often. It needs to travel, and it takes a few days to get to the uterus. And during that time, the cells are dividing, mostly focused on producing your supportive tissue, like your fallopian tube, or not your fallopian tube, your placenta, right? But this blastocyst is a fluid, unfilled cell from that cell division, and it's continuously dividing. It creates this embryonic disc that grows to become the embryo, but it also creates this outer layer called a trophoblast, and those grow to become the supporting cells that are necessary to support the baby in utero, the amniotic sac, the placenta, and the umbilical cord. So once the fertilized egg is implanted, so once the blastocyst implants into the uterus, we actually switch from the germinal phase to now the embryonic phase. So here's just a picture of the different stages and development that's happening in those in that germinal phase. So then we move into stage 2, which is the embryonic period, and this is from the 3rd to the 6th week of conception or pregnancy, and it actually, or 3rd through 8th week, I think. It's a 6-week period, so it's 2-week germinal period and then an 8-week embryonic period. This is the period of the fastest development. So by the time you're done with this 8th week, all major organ systems are developed, except your reproductive system's not fully developed. I should say the fetus's reproductive system, or embryos, reproductive system's not fully developed. Obviously, they still need time to mature, right? Their lungs and brain need the most time. They do develop in cephalocaudal fashion, so from head to toe, and proximal distal from the center outward. There are 3 layers of the embryonic disc that end up growing to become different parts of the body. So the ectoderm becomes the outside layer. That includes your nervous system, sensory organs, hair, nails, teeth, skin. The endoderm, endo is inside. That's the inner layer that becomes the respiratory, digestive, liver, and pancreas. And then there's the meso, or middle derm. That becomes the reproductive, excretory, circulatory, skeleton muscles, and inner layer of the skin. And you do have, within the 3rd week, heart, blood vessels in place. You do have a very primitive heartbeat at the 4th week, and the embryo is just tiny, still very much, just little cellular, organism. And at the end of the 2nd month, you start to see the limbs, that head, and it starts to now look like a little tiny human. So the embryonic period, again, you're developing within this amniotic sac. So the baby is growing within a sac. And that's the clear membrane. When you talk about your water breaking, your bag of water breaking, it's actually a rupturing of the sac, and the fluid flows out. And then you have a placenta that actually is attached to the uterus. Mom and baby's blood don't actually exchange. Everything is filtered through the placenta. So the placenta absorbs nutrients from mom and feeds the baby, it also absorbs all the waste and excrement from the baby, and then it's discharged through the mom's system. So that placenta is really, really critical. When we talk about prenatal development, as I mentioned, that embryonic period is really critical because this is the point at which it has the most rapid and dramatic growth and change. And it actually, now even it looks like a little alien, right? Remember that it grows from head to tail. So the head develops first, and it grows from the proximal in the middle to the distal to the outer edges. So then the last stage, which is the longest, is actually the fetal period, from 9 weeks all the way to the end of the pregnancy. It's called the fetal period. And so now we reference the baby as a fetus. At about the 9th or 10th week, the baby can respond to external stimulation. It will start to have some external genitalia that you'll start to see happen at about the beginning of the fetal period. About 12 weeks at the latest, you'll see sexual differentiation occur. And it starts to increase in size pretty dramatically at this point. Organs are still maturing, particularly the brain and the lungs. It does develop lanugo all over, which is soft, downy hair. And it starts to put on fat, especially near the end of the fetal period. So it's really, really important to make sure you're eating healthy. At 3.5 months, moms start to feel that first movement, quickening as we often call it. In 6 months, the baby can start to suck their thumb, open and close their eyes. They have their own sleep cycle. My youngest son, oh my gosh, he was up all night. He never slept. He went to bed so late. He was up first thing, and he continues to be that today. So interesting. The age of viability, or the age at which a fetus can survive outside the womb and live independently, is 22 to 26 weeks. And so up until this point is 100% dependent upon the host organism or the woman's body. So at about 7 months, it starts to turn upside down, which means it's kicking you in the ribs and heartburn and all that good stuff. But sometimes it stays in a breech position where it's feet first, or it can be in a transverse position where it's sideways. Both of those situations would warrant a C-section. So just some images of how that progression takes place. I want you to be cognizant, and I'm going to do a learning activity on this. But you know, everything in the environment can be a factor. From stress to diet to what we eat. Malnutrition is the #1 teratogen. A teratogen is anything that can negatively impact the development of the fetus or the baby. And malnutrition is the #1 cause, our #1 teratogen around the world. More pregnant women suffer from malnutrition than any other condition that can detrimentally impact the baby. So it's really important to be aware of teratogens. Some of them are self-imposed. You know, in America, the most common teratogens are drug and alcohol abuse. And we are damaging the development of the infant. But there's other things like bacteria, metals, radiation, anything that can negatively impact development is considered a teratogen. You are most vulnerable, definitely during that embryonic period, and the period at which you're exposed to the teratogen can influence the effect of the teratogen. So if you're exposed in the embryonic period, it can result in structural deformities. If you're exposed late during the fetal period, it might affect cognitive ability while the brain is still maturing. So keep those things in mind. if you're exposed during the 3rd or 5th week, that might impact the heart. So whatever's developing during that time is most vulnerable. So here's critical periods and different structures that are most at risk during those corresponding periods. And this actually takes you through some teratogens, so rubella, German measles, so they want to see if you're vaccinated early on and increase or reduce your risk of exposure. Syphilis, they'll test you for STDs, including HIV. There is a medication that you can take so that the baby, it reduces the risk of the baby getting HIV. Toxemia is when you have high blood pressure. Ectopic pregnancy is when the baby never actually makes it to the uterus and it stays in the fallopian tube, which can kill the mom. Rh incompatibility is when you have a negative blood type, but your baby has a positive blood type, so your body looks at that as an invader and tries to kill it. And there's also drugs that can be taken either over the counter or prescription medications. Many of them can be detrimental. Sometimes even medications dad is taking, so it's important to talk to the doctor. This is DES, which is an estrogen that was given to help reduce the risk of miscarriage at one time, but it actually has been associated with increased risk of cancers. Vitamins, even too much, prenatal vitamins are important, but again, follow your doctor's orders. Narcotics, drugs that you're taking, recreationally can be problematic. Most of the time they'll take you off any sedatives or tranquilizers. Even smoking marijuana can be problematic. Alcohol is associated with fetal alcohol syndrome, which can mimic, sometimes similar to Down syndrome. You have facial structural deformities, heart challenges, increased risks of autism, ADHD, mental retardation, and other challenges. Cigarette smoking, oh my gosh, it's the #1 cause of premature births and low birth weight. Constrict your blood vessels and your oxygen and nutrient supply. And then, of course, x-rays. So they always ask you if you're pregnant or have the risk of being pregnant if you're exposed to x-ray. So there are slides that go into each one of these individually. I'm actually going to have you do a learning activity where you're going to pick your own teratogen. Don't just, repeat a teratogen that someone else, has already covered. Try to be unique, so do your research. Other chromosomal and genetic abnormalities are a possibility to. Down syndrome is when the 21st chromosome, there's a 3rd chromosome instead of just 2 from mom, 1 from mom and 1 from dad. And there's, physical characteristics, and we're going to go through a chart, but older mothers are significantly at risk. Sickle cell anemia is when the red blood cells have an odd shape that increases the risk of clotting, and it can actually be fatal if it's too significant. Mostly found in African Americans, interestingly enough. It does have some adaptive value. In Africa, sickle-shaped blood cells actually have a greater resistance to malaria. And in Africa, there's a greater exposure. And so it can be detrimental, but it has served an adaptive feature. Tay-Sachs, which you see commonly in Jewish individuals. And this actually can be a severe neurological deficit that causes the infant to die before they reach age 5. So they literally degenerate. It's a very heart-wrenching disease. Sex-linked genetics, so that they're either on the X or the Y chromosome. Recessive traits need both chromosomes from mom and dad to have those, like cystic fibrosis, or if you are a woman and you carry something on your X chromosome, and now the sperm doesn't have anything to offset it, This is commonly expressed in male babies. Females are the carriers, but male babies because they don't have an offsetting chromosome. So here is a list of different disorders and chromosomal and genetic abnormalities that you can review. Some of them were on the list that we've already discussed, so pay attention to those. Here's the chart I was referencing with regard to the increasing risk of Down syndrome based on the mother's age. That 35 age range is when it starts to become exponentially more likely to have a baby with Down syndrome. When you're 49 or older, pretty much just over a 10% chance, or just under a 10% chance. Here's a risk of autism spectrum disorder. And so again, this is now looking at father's age. So fathers, older fathers actually have higher rates of not only autism, but schizophrenia. So their children grow up to develop one of those conditions. You can do genetic counseling. I've had to have genetic counseling because I have Jewish blood in me. And I actually have had an abnormal alpha-fetal protein test, and so I had to go in for genetic counseling. I've had to have an amniocentesis, where they extract the amniotic fluid and they look at the genetic makeup because there's tissue cells floating in that fluid. Chorionic villus sampling, they actually take a piece of the chorion in the amniotic sac. You can do an ultrasound, and that can tell you structural issues, but usually they use ultrasound in partnership or combination with an amniocentesis. And then parental blood tests so they can see what type of genetic markers you have. So let's talk a little bit about childbirth. You actually start to have contractions, and contractions, yes, they're painful, but they serve very valuable roles. They actually start to push the baby onto the cervix, and so it starts to prepare the cervix. The cervix dilates, it thins, it's called effacement, it thins and it opens. And that allows the baby to come through. We call it the birth canal, but it's really your vagina. And so there is this mucus plug that's often, as your cervix is starting to open and dilate, it drops the mucus plug. So you get this funky, it's a little bloody, but it's also gooey and a little gross. And it's dislodged, and that mucus is an indication that you're in labor. You do have some women where their water breaks. Once the water breaks, that baby's exposed now. It can be vulnerable. I mean, it's in the uterus, but it still has a greater risk of infection. So they will, if you're not having contractions, they'll induce and further that along. You might also have back aches, cramping, diarrhea. Some people vomit when they're in labor. The pain is excruciating, and so your body responds to it in different ways. Expect that. Don't be embarrassed by that. There's nothing to be ashamed of. It's your body going through a natural process. There are these fake contractions that you can have, which are Braxton Hicks contractions. And know that your body the oxytocin is actually causing the uterus to contract. And so there's an artificial one that they can give you to actually induce labor, Pitocin. So there's different stages of childbirth. The longest stage is the labor itself. And that's when you just have repeated contractions that are working on your cervix for effacement and dilation. The average woman is in labor for about 12 to 24 hours during the first pregnancy. And most of the time, your contractions are a little bit further apart. As they start to get closer together, it becomes nearing and the time to actually birth the baby. And they become more intense and last longer as they start to get closer together. And the baby, starts to what we call transition or drop into the vagina, the birth canal. And at about full dilation, you can actually start to have intense pain. Your body kind of will let you know it's time to push. You have this horrible urge to push, much like having a bowel movement, right? When your body knows you have to go. Your body knows when it's time to birth a child too. There could be complications, so the doctor sometimes might tell you not to push. During birth, that's when that baby is actually passing through the birth canal and it's coming out of you. This is just a few minutes sometimes for some people, those women that we hate. Sometimes it can be a few hours, and that's much more daunting. If it lasts too long, they might actually take you in for a C-section, which kind of sucks, right? Because you went through all this labor. It's much harder to heal from a C-section than it is a vaginal birth. And so that's why a vaginal birth is preferred. It also helps to better prepare the baby. It starts to clear the baby's lungs, and it reduces the risk of challenges for the baby. It actually exposes them to wonderful like bacterial properties, antimicrobial properties in the vagina, that flora in the vagina, so the baby is more resistant to illness down the road. Sometimes, so we talk about crowning. Sometimes it's referred to as the ring of fire, and that's when you can see the baby's head, the cervix, the vagina is stretched around the baby's head. Once in a while, or I shouldn't say once in a while, it was formerly common practice. It's not as much common practice. I actually prefer it, but they actually will do in a episiotomy. They'll cut you and do an incision in that tissue, often near the perineum, because you can actually tear all the way down to the anus, and that can be very, very painful. So they do this to prevent tearing. And then the third stage, which they do not tell you about, and you should know about it because it can be miserable, is the afterbirth. So you think childbirth ends with the baby. It does not. You have to deliver the placenta and everything in there, so it reduces your risk of infection and death as the mother. And that can take, a few minutes for some, or hours. Sometimes the placenta doesn't actually detach, and so they have to help it along. But sometimes your contractions will stop, and so they'll give you a medication, intensify those contractions. Sometimes the nurses get up there and knead your stomach and push that out. Sometimes they will encourage you to breastfeed right away because that actually will stimulate contractions. Oxytocin, the same hormone that causes you to release, or it's prolactin, right? It causes you to release that milk. It also, because you don't have milk right away, by the way, but you have colostrum. Milk takes a little while to come in. Sometimes it takes a couple of days, but that same hormone that helps with lactation also causes your uterus to contract. It also causes you to bond with the baby. It's called the bonding hormone. You release it during orgasm too, interestingly enough. Anyway, so different images. Here's where we will see the crown. This is the transition where the baby's starting to enter into the vaginal canal. Notice how short it is, right? So the cervix is opened and dilated, ready to go. Then this is crowning, where you can see the baby's head. Here's where you're starting to see the head come out. The shoulders are the hardest part. And then you ultimately then at the end stage, you need to deliver the placenta and all the other wonderful gunk that comes with it. After the baby's born, they do a number of things. They suction them. It's called aspiration, so they can clear all the fluid and stuff. Remember, they're swimming inside of you. They're living within fluid, so they need to clear that out so the baby can actually breathe. That's what happens when you hear the crying. They will cut the umbilical cord, and they will, reduce it down and clamp it. As it takes about 10 days for that to heal. So you kind of put alcohol on it with a cotton swab every day, and after a while it just falls off, and then the baby has a belly button, but that's where the umbilical cord was attached to the baby. There's also this nitrate and antibiotic ointment that gets put into the baby's eyes, so there aren't any infections that'll develop that'll negatively affect vision. The baby gets tagged, and they might also get a vitamin K shot so that they don't have any problems with blood clotting. Sometimes when you have a baby, they might give you a general anesthesia. Typically, if you may have heard of like an epidural, or they can do a block. Anyway, these actually, sometimes they don't make the pain go away, but they can greatly reduce the pain. And sometimes it actually crosses that placenta, and the baby can actually be more lethargic and not as active as well. And so it's when it's localized, it's that's when you see the epidural, and or a block, and it's specific to those areas. But it too can affect the baby. And I don't know what the risks are. I've never had an epidural. They've always been a little more scary for me. So in terms of childbirth, the Lamaze method's the most common, where you learn breathing techniques, you learn how to use visualization and mental images, relaxation strategies that work for you. The father or your coach, I was a coach for my sisters. My sister was a coach for me with the last baby. But they also help you, coach you through those breathing processes and through the relaxation exercises. They're a support person for you. It might make you feel more in control and make childbirth a little bit easier to manage. Sometimes you need to go in for a C-section, which is a surgery, right? The woman is under general anesthesia. The abdomen is cut open, the uterus is cut open, the baby is removed. They sew up the uterus, they put your organs back up in there, and then they sew up your skin. It can cause an increased risk of UTIs, challenges with the uterine wall. It does increase the risk of death significantly compared to vaginal deliveries. It's a surgery, so surgeries increase risks. It can be dangerous, so it's not preferred. They've become far too common in the U.S. They may also do them if a woman has herpes or if a woman has HIV, so that those aren't actually passed on to the baby, and then breech and transverse positions. So sometimes they are used by doctors. Some people say they're used by doctors just to control their schedule. And that's interesting because there's a higher rate of C-sections before the weekend starts, right? So we deliver babies so it doesn't interfere with our weekend plans. There can be challenges that emerge during birthing. Anoxia is when there's oxygen deprivation. Some anoxia is normal, right? The oxygen is transferred to the baby through the umbilical cord, and that's kind of compressed during delivery. And so if it's extended, it's problematic. That's why they're monitoring the baby's oxygen levels and the baby's heart rate, and when the baby's in distress, they'll take you in for a C-section. Stillbirth is when the baby is born dead. Sometimes they will discover the fetus has died in utero before you even go into labor. And so they will actually have the mother go through labor and deliver knowing that her baby has passed away. It can definitely be traumatic, so it's important to get the appropriate help and support and counseling after. You also have preterm and low birth weight babies, so if they're born before 37 weeks or they're less than 5 pounds, they're at risk of a whole host of challenges. Smoking increases the risks of this, and it increases the risk of the baby dying. They're also more likely to have neurological problems, developmental problems like attention challenges, ADD, autism, things of that nature. Sometimes if you have your babies too close together, that increases the risk. If you, again, are smoking or you're malnourished, that increases the risk. But unfortunately, these babies don't get that fat layer underneath the skin. They have a hard time regulating their body temperature, so they stay in the hospital, live in incubators. They may not have their muscles fully developed, so they can't breathe and suck as well. So they might be fed through a tube, or sometimes they're intubated. They don't have surfactant that's produced in those final weeks, and so it actually keeps the walls or airways of the lungs from sticking together. So in newborn babies or premature babies, it's not uncommon that they will they'll give them surfactant to help their lungs mature. But the NICU is the neonatal intensive care unit, and they're the ones that take care of your premature babies or babies born with any challenges. That postpartum period is the period following the delivery, and that's normally about a 3-week period. You are potentially going to experience some baby blues. A good portion of mothers do this. It could be related to hormone. If you do have depression prior to having a baby, you are at an increased risk of postpartum depression. That happens to about 20%. 10 to 20% of women. It can sometimes begin a little bit before delivery, but usually it's within 4 weeks after delivery. Similar, all the same feelings of depression, except sometimes they can actually experience psychosis. And it can, if it's really severe, you've seen those stories of women actually killing their babies, and it could be associated to postpartum psychosis. So it's really important to make sure that although the risk is low for psychotic breaks, that you are getting the appropriate therapy. It's okay to ask for help. Talk to your doctor. It's built into our post-delivery screenings now, into the wellness checks for the baby. Breastfeeding is actually recommended. A lot of people, it's linked to work, so they don't breastfeed longer than 6 months, but it's actually recommended at least a year. Women who go back to work, it's hard, especially when a lot of our workplaces do not have lactation rooms and no place for you to pump or feed the baby, and so it can become a challenge. A lot of people choose bottle feeding if they want the father involved or other people to be able to help. If you have HIV, you cannot breastfeed. You need to bottle feed because HIV can be transmitted through breast milk. And so that's the only case really that breastfeeding is not in the best interest of the child. Otherwise, important antibodies are passed from mom to baby. So breastfeeding actually reduces their risk of illness, allergies, SIDS, diabetes, all sorts of things. And remember I said oxytocin helps to cause that lactation. It also causes your uterus to contract. So especially with the second baby on, you might feel contractions when you're breastfeeding, which can be painful. I'm not going to lie to you. Breastfeeding can delay menstruation. We don't use it as a form of birth control. I am here to tell you, as someone who is breastfeeding and got pregnant, that antibiotics actually can increase your risk. So otherwise, at about 2 to 3 months after you have the baby, you might have a normal menstrual cycle. Keep in mind you can get pregnant. You often ovulate before your you do ovulate before your menstrual cycle, so you can get pregnant before knowing that you can get pregnant. And then it is okay to have sex, usually about 7 weeks after. If you've had a C-section, they say about 8, but 6 weeks for a vaginal delivery. Some people are traumatized and they need more time. Some people need less time. But just so you can let your body heal, 6 weeks, 6 to 8 weeks is the guideline. Just some funny little comments or some little funnies to end our session. As a woman who's birthed 4 children, I can tell you I'm an incredibly strong and resilient woman, but also having a sister who's never birthed children, I am also a very jealous woman. Raising kids is a challenge. They're your source of greatest joy and your source of greatest pain sometimes. And so, again, I just want to be sensitive and compassionate to those who can't conceive or have had difficulty or a series of miscarriages. I also want to be respectful of those who choose not to conceive. So whatever your choices are for you or your situation, love and support to all of you. Bye.